Hi, this is Shannon Calvert. I am presenting a 30-year-old woman who is lactating and she has a UTI. So what are we going to do about it now? So meet Betsy. Betsy is a 30-year-old female who presents today with complaints of dysuria for the past 2 days. She states, "I feel like I have to pee constantly, but when she does, it's very painful." When asked, she denies fever or chills, and she says that she has no other pain. Information about Betsy: she is a healthy 30-year-old. Her only other medical history, according to her, is an occasional migraine. She states that they were in the past worse. They were relieved when she took her triptan, which was Zomig, and she takes no other medications. She does have a Mirena IUD in place. She's had that since about 6 weeks after the birth of her son. She does not have any other children, and she states that she has in the past had a UTI and had similar symptoms. She received antibiotics for them, and she didn't have any other problems. So she's wondering if that might be what her problem is today. Betsy is married. She has one child, the son that I noted above, and she is a stay-at-home mom. She takes no daily medications. However, she does have that prescription for Zomig, which she takes 5 milligrams when she has a migraine headache come on. She can repeat the dose 2 hours later if her symptoms haven't resolved. She says it's been months since she's had to take this medication and that her migraines have lessened significantly since the birth of her son. So what do we do now? I've asked Betsy if she could provide me with a urine sample. We got a set of vital signs on her. She does not have a fever. Her heart rate is fine. You can see her blood pressure is 120/68, which is perfect. She is able to provide me with a sample, and it has tested positive for nitrites. So Betsy does in fact have a urinary tract infection, or UTI. A urinary tract infection is an infection that involves any part of your urinary system, your kidneys, your ureters, bladder, or urethra. Most UTIs are in the lower tract, involving the bladder and the urethra. More complicated UTIs involve the kidneys, and that is not in fact her issue. Nursing moms are at an increased risk for UTIs because they have fluctuations in their estrogen levels. They have thinner vaginal mucosa, their vaginal pH changes, and there's an overgrowth of abnormal bacteria. The thinned out mucosa allows bacteria to more easily enter the urethra during intercourse, which allows them to migrate more easily up to the bladder and then proliferate and cause this infection. Betsy does need antibiotic therapy, at least that's what we think. Antibiotics. Betsy does take some concern that she continues to nurse her 18-month-old son, mostly at night just before he goes to bed. She's concerned about the antibiotics crossing into her breast milk and reaching the baby and what effect it may have on him. So what are our options? According to the American Academy of Pediatrics, antibiotics are one of the most common medications prescribed to moms, and they all pass into the breast milk at some degree. However, if you think about it, a medication can be administered safely to a premature infant or a neonate, then it is safe for a mom to take while breastfeeding, right? So there are many antibiotics that can in fact be given to Betsy without risk for the baby. Also, since Betsy is still breastfeeding her son past 1 year of age, after nursing for a year, the quantity of your breast milk is generally a relatively smaller amount, so that in fact reduces the amount of medication that's transferred to the milk. With this information, again, we have many antibiotic options for her. So antibiotic options for Betsy: TMP SMX DS, 1 tablet, PO, BID, times 3 days. Macrobid, 100 milligrams, PO, BID, for 5 days. Fosfomycin, 3 grams, PO, times 1 dose. Ciprofloxacin, 250 milligrams, PO, BID, or extended release 500 milligrams PO, Q24 hours times 3 days. Levofloxacin, 250 milligrams, Q24 hours times 3 days. Amoxicillin clavulanate, 875 125 milligram PO, BID times 7 days. And cephalexin, 500 milligrams PO, BID times 5 to 7 days. The ciprofloxacin and the levofloxacin should be reserved for more complicated UTIs, so I'm not even going to consider those. I've opted to look at the first 3 medications and take those into consideration, as those are the top 3 recommendations from the Sanford Guide. So my recommendation would be that she takes TMP-SMX-DS, which is also known as Bactrim, 1 tablet BID for 3 days. The way that this works is it blocks the bacteria's ability to make and use folate, which is necessary for them to synthesize the nucleic acids necessary for them to make up their DNA. So it basically blocks the ability for them to create and recreate more, and it kills the bacteria off. Of the top 3 recommendations, this is the cheapest. 6 pills would cost Betsy approximately $5. Fosfomycin is very inviting. It's only 1 dose per period. However, it's at the cost of approximately $100, and there really wasn't any variation. $95 to $100 was what I saw. Excuse me. And macrobid is approximately $15 with a slightly longer course. So I mean, that's an option as well for her if she so chose. But I would say Bactrim would be what I would decide to offer Betsy. So possible side effects and interactions. Possible side effects are very similar in a lot of antibiotics: nausea, vomiting, diarrhea, loss of appetite. Serious side effects that are very rare, but you should let your provider know about right away, are muscle weakness, mood or mental changes, any blood in your urine or a change in the amount of urine, because that might be suggestive of some type of kidney problem. Extreme drowsiness, signs of low blood sugar, sudden sweating, shaking, fast heartbeat, hunger, blurred vision, dizziness, or tingling of the hands and feet. Some medications, however, these are not all medications to avoid while you're taking this Bactrim, would be blood thinners such as Coumadin, dofetilide, methenamine, and methotrexate. Again, there are many others, including over-the-counter medications and herbal remedies, so please always check with your provider or pharmacist. Some antibiotics decrease the effectiveness of hormonal contraceptives, so be sure to check with your provider or pharmacist if this is your method of birth control. Check with your provider before consuming alcohol with this medication, because it can cause unpleasant effects, side effects: fast heartbeats, warmness or redness under the skin, tingling, nausea, and vomiting. So Betsy and I chatted. We reviewed the possible side effects and interactions. I reminded Betsy that should she notice any changes in her son's eating, sleeping, habits, fussiness, or if he develops a rash, she should call the child's PCP and let them know that she has been taking Bactrim for a UTI and see what their recommendations might be. We also discussed that most UTIs are caused by E. coli, which is a GI bug, and we discussed why this puts women at an increased risk for UTIs, and that would be because they have a short length of their urethra, and there's a small distance between their anus and their urethra. Intercourse can precipitate a UTI by helping that bacteria move closer towards that urethra. Without treatment, 25 to 42% of uncomplicated acute cystitis cases in women will resolve spontaneously. This was of interest to Betsy, as she did not know that and had not heard that in the past. So Betsy's decision. Betsy has decided that she would prefer to wait another day or two to see if her UTI resolves. I think that this is reasonable, so I sent her home with a prescription for Bactrim, 1 tablet BID for 3 days, that she can fill should her symptoms not resolve or should they get worse. And after the 3 days, if her symptoms have not resolved, she can give me a call back and I will gladly extend her treatment or course. And I've asked Betsy that she call with any significant changes such as back pain or fever, as this could be a sign that her kidneys have become involved, and it would be important that we become aggressive in treating this infection. So thank you for listening. I hope you enjoyed and I hope you learned something, because I did.